Welcome to Egg Donation Friends webinar number 12. Can you hear me? I hope you can hear
Yes.
me well. Today's topic is donor eggs, a precious gift. It's all about quality, number of eggs, and qualification process. Today's presenter is Dr. Robert Najdecki, Scientific Director of Assisting Nature, IVF Clinic in Greece. His presentation will last about 25-30 minutes, and then the Q&A session will follow. You can type, if you want to ask a question, you can type the questions in the chat section. The webinar is being recorded, and you'll be able to view the recording on our website. We will also publish transcript with all the questions and answers. Dr. Robert, good evening.
Hello, thank you, Dorothy. Dear all egg donation friends, it's a great pleasure and honor to be here with you. Many thanks to organizers, IVF Media and eggdonationfriends.com for their invitation to such popular and high-quality webinars.
It's a pleasure to have you. Okay, we can start with the presentation, yes?
Okay, thanks. It took several years for egg donation to become a widely accepted method, but now it's a rather common solution for interfaith couples to conceive a child. Success rates with egg donation are high, particularly compared to pregnancy rates in women with poor egg quality and quantity. Research has also proven that the method has no adverse effect to the relationship between mother, father, and child, despite the lack of genetic link between mother and child. We are pleased to provide the procedure of egg donation, which is permitted in our country and is lawful under Greek law. Egg donation is anonymous, voluntary, and free. The primary benefit to every woman who donates eggs should be the altruistic aspect of helping another person or couple achieve pregnancy. Every time a couple starts the egg donation program, a huge question arises. Who is the person behind the mask of anonymity that will offer you their eggs and a chance to parenthood? Donor eggs IVF opened up a world of possibilities for women who have struggled to conceive, women with primary ovarian failure, menopausal, either naturally or as a result of surgery, radiation of chemotherapy, women that have undergone repeated failed IVF attempts, or with a genetic disorder which could be passed on to their child. Egg donation treatment involves fertilizing the donor eggs with sperm from the recipient's partner or donor and transferring the resulting embryos into the recipient's womb. Basically, in assisting nature, we use two terms to describe those categories of patients: donor patient and recipient patients. Both of them are very, very important patients to us. However, we know and experience that in vitro fertilization treatment while using donor eggs is a more complex and difficult process. While two women are treated simultaneously, it is the donor patient that is young, healthy, and innocent that takes a risk of all possible complications. Nobody wants to talk about it, but the donor is our sensitive and very important patient. And this is the reason we must care about them, because they trust us. Finding a right donor patient is a difficult goal for every assisted reproduction unit. All eggs and sperm donors are anonymous by law in Greece. As a result, large numbers of donors are available, eliminating long waiting lists for treatment. So most likely your egg donation treatment can start straight away once a suitable donor is found. Due to the anonymity law, only non-identifying information can be given to a recipient. However, you will have access to the physical characteristics of the donor as well as the age, country of origin, and level of education. Our rigorous screening testing process ensures the highest quality donor eggs available anywhere. Our experienced team includes a medical director, genetists, midwives, donor coordinators. Each egg donor's individual and family health histories, medical tests, and other background information are rigorously studied to ensure she meets our highly selective standards. Donors are extensively tested and screened currently, including the following procedure. As you see in the slide, we select donors with proven fertile, age under 30, and the normal mental status. The screening involves psychological evaluation, motivation for becoming a donor, of course, medical history, fertility evaluation by hormone testing, infectious disease test, toxicology, and genetic screening. Our physician will review very detailed application, and if we are able to accept it, we will invite them to an orientation meeting. During this informational session, we will review all of the steps and details involved with being an egg donor and answer any questions they may have. They are more than welcome to bring their partner or a friend to this meeting, which lasts about 35 minutes to 1 hour. Furthermore, all of our donors are younger than 30 years old and of proven fertility, which means that they already have had a pregnancy of their own, either already have a child. So you can be assured that having your donor egg IVF treatment and assisting nature IVF is as safe as it can possibly be. Detailed screening of candidates donors is necessary to reject or to choose the right woman who can help other women to fulfill their dreams of motherhood, always in a safe and controlled manner. The first step of choosing the right donors is to examine them for particular risk factors and to exclude them from the donor pool. The screening includes psychological evaluation of a potential donor as well. The evaluation is important to guarantee the psychological status of the donor and to evaluate if this woman is truly ready to cope with the demands and the stress of her decision to serve as a donor. Applicants undergo a psychological evaluation with a mental health professional and take a MMPI test or equivalent to assess their mental health and emotional readiness to become an egg donor. This test is very difficult for the patients and difficult for the professional. It's about 300 multiple choice questions and answers, and it maybe lasts about 1 until 2 hours. We make sure each applicant has a through understanding of what is involved in donating her eggs in terms of time, physical implications, logistics, and last but not least, the medical risks involved in the procedure. Medical exams after the egg donor orientation meetings, we will help them book an appointment to come in to meet our physician for a physical exam, which will include a pelvic ultrasound and a blood draw for all the imperative screening. There is no cost for the appointment or any screenings, and no insurance information is required. The screening of donors include evaluation, fertility evaluation by hormone testing, antimullerian hormone, follicular stimulation hormone, prolactin, estradiol, LH, progesterone, thyroid hormones, and other, like vitamin D deficiency, vitamin B12 deficiency, and of course, vaginal ultrasound of the ovaries, endometrium lining, cytology, and full vaginal culture. In addition, besides the mandatory test for infection diseases, toxicology examination of the potential donors is required in order to exclude possible drug addicts from the donation program. We have added a also known as a urine toxicology screen to detect and evaluate the presence of illegal drug intoxication, ensuring that the individual selected to become an egg donor is drug-free. In this slide, we have again some information about screening of donors by infectious diseases testing. Here is HIV, hepatitis B, hepatitis C, syphilis, and genetic testings, full chromosome analysis karyotype, cystic fibrosis, natural killer cells, and fragile AIDS. In order to be able to select a donor that doesn't carry the same mutation as the member of the couple who will provide the gametes, eggs or sperm. In addition to the test provided by the Greek law for male and female donors with assisting nature, we can also test for the more severe hereditary genetic diseases. Specifically, autosomal recessive disorders like Duchenne-Becker muscular dystrophy, cystic fibrosis, Gaucher disease, Wilson disease, Smith-Lemmy-Opitz syndrome, deficiency of acyl-CoA dehydrogenase, congenital disorder of glycosylation type 1A, or X-linked diseases like Fragile X syndrome, muscular dystrophy of the spine. Once they have completed their screening and application, they decide along with a photo will go to a confidential database accessible only by their egg donor coordinator, midwife, and treating physician seeking an egg donor to match potential recipient parents. Any identifiable information such as their name, picture, will never be available to our patients because it has been institutionalized by the Greek legal framework that egg of sperm donation is absolutely and strictly anonymous. Patients choose their egg donors for many reasons, often because they have similar phenotypic characteristics and interests. The information they have given during their application process will facilitate our patients to know if they have made the right choice for their future family. According to the donor-patient preparation, we must explain some important issues. In the past, we have been using long protocols to stimulate follicle growth. These protocols were very convenient for the doctors and units, carrying a high number of follicles and eggs, but extremely inconvenient for the donor patients, putting them into a risk of hyperstimulation, hospitalization, and serious complications. All these protocols were abandoned globally by good practices, especially when European Society of Human Reproduction and American Society of Reproductive Medicine have started their no hyperstimulation clinic campaign. It is extremely important to ask your clinic how they stimulate their donors. Will you feel well when knowing that your donated eggs were hyperstimulated only to achieve a higher egg number without any care of quality and donor-patient condition? What is the conclusion? Look for the clinic with high ethical standards, which use mild stimulation protocols and like car catalysts protect their customers from extreme pollution. The second important issue is the number of eggs carrying into the program. Some clinics guarantee 4, 5, 6, 8 eggs, some other all eggs. What does it mean? Does the higher egg number influence in higher pregnancy rate? Let's try to answer it. However, before answering, we must realize how the program works. All oocytes designated for one donation cycles are involved into the ICSI procedure, and 24 hours later, we have eggs fertilized. This is the first step and first possible state of losing some of the eggs. Afterwards, the incubation process from fertilized eggs until blastocyst stage lasts another 5 days, and this is the second possible period of losing some of the embryos. In this moment, we use the term blastulation rate. What do we mean by blastulation rate? It is the percentage of the fertilized oocytes which become 5th-day embryos, blastocysts. If we have blastulation rate about 50% or higher in our lab, which is a very good score and absolutely realistic, it means that from 6 oocytes used, at least 3 will reach the blastocyst stage. Here you have the tables and view like in the space program, what we see inside in the unit inside the lab. Here we have a case of the one donor patient and 2 cases with another fertilization process. In the left up table, we see that the first time we pick up 9 oocytes, and in the process of fertilization of ICSI, we lost 4 of them. Then we have 56% of fertilization. In the process of incubation into the day 5th, we achieved 3 blastocysts. We performed the single blastocyst transfer without any results, with negative results. Of course, we have another 2 blastocysts for future transfer. In the case down, from the same donor, we see that in the next attempt, we pick up 10 oocytes, and by fertilization process, we had 100% of fertilization, that we had 10 eggs fertilized. From this 10 eggs fertilized, we have 10 excellent blastocysts, and with the first embryo transfer, the patients was positive pregnancy test, and of course ongoing pregnancy go well. And what we see here, the same donor patient, but very different semen samples. And this is the problem. What's happened? Let's go. The way from an oocyte to a blastocyst is not always easy and predetermined. Not all oocytes become blastocysts. Finally, what matters? Eggs or blastocysts? And what about the male factor? As you see here, in the case of normal semen sample, plus 6, 8 eggs used, we have on average 3-4 blastocysts. But in the case of an abnormal semen sample, plus 8-10 eggs used, we have on average 2-3 blastocysts. What is the conclusion? There is a real value in every IVF program, and this is a blastocyst. Eggs and sperm are raw materials. Is there any way to check the quality of the blastocysts? Of course, yes. We check them by morphological assessment and by new methods, karyotype, by NGS, next generation sequencing. The euploid blastocysts have more than 60% possibility of implantation. And here we must say that exclusive and future ideal donation programs may include prenatal genetic screenings of all blastocysts by next generation sequencing. Another step in the preparation of the recipient is the embryo transfer test before the attempt, which we know like mock transfer, the ultrasound scans and hormonal tests during the substitution protocols, and hysteroscopy, which we knew like our study for all reproductive patients, and also pharmaceutical preparation of endometrium. Egg recipient is submitted also to the following tests: blood test versus complete blood count, antibodies for hepatitis B, C, HIV, hemoglobin electrophoresis, mycoplasma, ureaplasma, and chlamydia. Of course, also preparation of a spouse or sperm donor. Same exams, plus, in many cases, DFA, DNA fragmentation index, that it's very, very important to us because it asks about the quality of the sperm. And the successful egg donation program must include the good coordination between the donor and the recipient, good donor preparation, high laboratory specifications, well-trained medical staff, proper preparation of endometrium. As you see in the chart here, the egg donation has proved to be very successful, either using fresh or frozen eggs, with success rates up to 59% for embryo transfer per treatment cycle and up to 71% for clinical pregnancies. One moment.
Oh, I'm sorry, Dr. Robert. I think I
no problem.
might have changed
we are
the slide
here.
line.
Okay.
Okay. I'm sorry for that.
Every year, we offer to our present and past donor patients free of charge tests and exams, such as mammography, breast ultrasound scanning, cytology, and blood testing. This year, we had 2 cases where we performed the hysteroscopic polyp extraction and breast adenoma extraction, always free of charge. We started to offer them detailed cardiological exams, sometimes even with triplex ultrasound scan. This relationship leads us to have always excellent donors and waiting lists never more than 2 months. We are not a unit with a mass egg production. Our concept is to offer you our donor with her eggs and not eggs of somebody. Assisting Nature's Donation Office is a completely separate service, which managed only by certified and mostly highly expertise scientists. Our donation office is administered by the senior embryologist lab director, the senior midwife coordinator, and 2 supervising gynecologists specialized in assisting reproduction. Experience is a combination of knowledge and wisdom. Provider of assisted reproduction should be fellowship trained and board certified, both of which are the standards of our clinic. And finishing, let's take a look into the basic Greek law topics. The egg donation is an altruistic act, voluntary and unpaid. Donors are compensated for their days off from work and their physical strain with the framework of the donation procedure and for their travel expenses. Egg and sperm donation is permitted in Greece, provided the donors remain anonymous. Donation program for recipient patients is not permitted to women over 50 years old. Egg donors sign a consent form of acceptance in regards to donating their eggs. Recipient couples sign a consent form that they agree to undergo IVF treatment with oocyte donation. If they are married, they have to provide their marriage certificate. If not, they are obliged to sign a notary deed prior to their treatment. Thank you very much for your attention.
Dr. Robert, thank you very much for great presentation. So now it's time for questions and answer session. We already have a couple of questions, so let's start.
Okay.
Let's start.
How many blastocysts do you discard after PGS?
Oh, okay, sorry, because it does not appear on my screen yet.